Hi everybody. I decided to come outside and do a little update video touching base on the trip from last week. So here we go. It's a beautiful day. We're going to do some stretches as we talk. So on Saturday, April 1st, I got back from Washington, D.C. And if you don't know, I went to Washington, D.C. to speak with elected officials on requesting a reform and letting them know, if we don't see changes within our endometriosis community from their level, that we are going to be pushing for the Department of Justice to do a reform and a few other things at a federal level. We also pushed for some advocacy and awareness as meeting with these officials. We asked them what they knew about endometriosis, and most of them, either really didn't know about it, had the wrong definition, or just kind of got the rundown because of school. So it was actually nice that we were the first basis of heavy information that they got in regards to this disease, especially with it becoming full throttle and a lot of us really trying to go federal and attack this. So if you're wondering why we're going federally, let's break this down a little bit. The 14th Amendment speaks for equal protection under law for all. Equal protection under law for all. Am I right? So when we look at our health care and what's going on, we definitely do not have equal protection. There are health care laws out there right now that are being broke by the healthcare system when they are assigned to treat us. That being having the assumption that endometriosis is a uterus-based working woman's disease, as well as it being period-based. It's just a bad period. That in itself is a stigmatization, as well as a discriminatory stigmatization. We are women, and so we're supposed to just deal with the pain because we were born to have this pain, as well as born to give birth, which is also painful. It's just not right, and it's not true. So this is step one in the discriminatory process. When we go into other levels of the discrimination factor, we also start looking back at the children who have these early signs. For instance, I was 9 years old when I had my earliest symptoms of endometriosis, and it was passing out on the playground before I even had onsets of pain. They just told me that I would either pass out too long, I was hanging upside down too long and I passed out, or, they truly had no idea at that age. When I started having more upset stomachs, they started doing some scopes and they started seeing inflammation, and they were just like, oh, we just got to watch what you're giving her to eat, blah, 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 blah. But I had increase in pains, increase of hospital visits, but everything was just okay because I was becoming a woman. I was coming of reproductive age, so it was all normal. No, none of it was normal because 20 years later I was diagnosed with endometriosis on my colon, rectum, and bladder, and if I was not diagnosed, I would have died from bleeding out of my rectum. So we look back at the young girls presenting into the hospital with lower abdominal pain compared to the young boys coming into the hospital with lower abdominal pain. The young boys are more likely to get exploratory surgery, especially appendix removals, than young girls. It's really crazy when you start looking at these numbers and looking at the things that are actually done for these individuals in the healthcare system once they present with these symptoms. And this is also a key for investigations, and why I think an investigation is also the key for helping our endometriosis community, is when we actually look down to what's happening in the healthcare system to the patients themselves. We are going to open up a big old wide book. I'm telling you what, because like I said, I started gathering many patient stories because I believe patient stories is going to be the window in to seeing and breaking foot what truly needs to be looked at for endometriosis care. As we continue looking into these patient stories, we see the multiple barriers of discrimination that I'm talking about, as well as the barrier with gender. You'd be like, oh, wow, Gender, yeah, because, we're sitting here talking about a disease that's been considered a woman's-based period disease for decades, and now we have proof that it's happening in children, which is where they are not women. We have proof that it's also been found in fetuses, both male and female fetuses, and also cis men, like men having endometriosis. Yes, these numbers are limited, but let me talk about limited numbers real quick. We want to talk about, those limited cases that we don't need to focus on them because they're rare. Number one, thoracic endometriosis used to be considered as rare. Am I correct? Yeah, I'm pretty sure I'm correct. Now, when we talk about thoracic endometriosis, it is not rare anymore. Why? Because we focused on those rare cases and we realized, wow, it's not so rare at all. Now, let's talk about the actual numbers here. If we look at the amount of actual endometriosis specialists that are having the actual education and the proper, skills and basis for their specialty title, those numbers are less than 300 worldwide. So if we have less than 300 worldwide specialists that know and have the proper knowledge on what to do, and then we look at the small numbers that are actually being acknowledged, like the 26 cases of cis men that have endometriosis, that's because in the 200 individuals and specialists that know what they're doing, they were able to properly diagnose and report those individuals. So if we're talking about rare and numbers and small numbers, we have a small amount of number of individuals who actually know what the hell they're doing in our community and are making leads. And if we follow these leads, we're actually going to get somewhere. And those leads that I want us to follow include these limited number of cases that we have found in men, and the limited number of cases in trans individuals and non-binary individuals, because there are these specialists working daily on these people, on men, on trans individuals, on non-binary individuals, but they don't have the time because they're working so hard helping the patients. So these specialists that are doing the work don't even have the time to even do the proper recording or the reporting and the scholarly studies that need to be done because they're the only ones doing it and they just don't have the time. So here we are with discrimination, time, knowledge, and the fact that we don't even want to acknowledge the limited numbers. And we look at those limited numbers, and when I start discussing the men, a lot of these women start being, they can handle the disease a little bit, we're more important. I want to talk about that. That is discrimination, folks. That is discrimination, and that is what is happening to us women. And when it's happening to us, we have a problem with it. But when it starts to happen and we start opening up the layers of endometriosis and start realizing that it's happening to everybody, we don't want to acknowledge it. Come on, everybody. This is a problem. Now, as we go back and we talk about what we did in Washington, D.C., I handed them the petition that is in my bio, the petition that now has well over 1,000 signatures right now and growing, folks, to take to the Department of Justice. I handed this petition over and said, this is what's going to happen if you guys don't do anything. This is what's happening and it will continue to happen if you guys don't do anything. And that includes harm, and that includes us dying. Yeah, endometriosis is definitely killing us. And I've done a video about this before, and I've also handed them a list of individuals in our community who have passed away. I handed them the 30 individual stories that I have collected and let them know that, yes, all of these stories has many similarities, but they also have many individual differences that are also key in helping the community and figuring out what is going on. If we sit here and we look at the disease and just look at the disease itself, we're not going to get anywhere. And if we continue looking at the disease and the old data and the thought process of it being a uterus-based disease and the uterus tissue being misplaced, we're not going to get anywhere. I had to literally explain the fact that when we're focusing on these points with our new research and our new studies, all of the new 2023 studies that they're looking for participants to be a part in are all being done on old data, on old research that is not going to get us anywhere in the future. And I have had it. And I let them know that. And I want you all to know that I've had it, and I'm going to work tirelessly to figure it out for us, because I'm lucky enough that I feel the way that I do to be able to fight for you guys. I feel like I got hit by a semi-truck this morning. I just recently got out of bed, came out to enjoy the sun because I needed to. And if I didn't, I would have just been miserable in bed, because I spent, 4 days doing nonprofit work for a multi-billion-dollar company in healthcare. The multi-billion-dollar company is the healthcare industry that should be protecting us, and they're not. I'm fighting for our protection, and I want you guys to know that this is not the end. Me going to Washington, D.C. and meeting with the few elected officials that I did meet is just the beginning. And the Department of Justice is going to be hearing from me next. Our governors are going to be hearing from us all across the nation. We are not going to be loud. March is not the only month that we need to be loud and we need to be advocating for ourselves. It needs to be year long, or they're not going to take us seriously. So let's go. Year long, everybody. I can't wait, and I hope you guys want to be along with me in this mission. And if you haven't signed that petition yet, get over there and sign it, because it is growing, and that is going to be the start of something huge in the history of endometriosis. And I can't wait. I just can't wait to be a part of it. You guys have no idea. I'm so giddy. I'm going to finish up a few little stretches. I'm going to get off of here. Forward we go. Forward we go.